In Nigeria, President Muhammadu Buhari has declared the country's water supply crisis a state of emergency. He made the declaration at the launch of an action plan to revitalize water supplies, sanitation and hygiene. CT10's Deju Madmus now reports.
Across most of rural Nigeria and even in some urban centers, people get their drinking water from open wells. In this community in northeastern Yobe State, wells are the only source of water supply, resulting in poor sanitation and hygiene practices. Just a few months ago, a cholera outbreak claimed around 100 lives here. A report by the United Nations and WaterAid Nigeria indicates that 60 million Nigerians don't have access to potable water. The report also finds that around 120 million people don't have proper toilet facilities. These grim statistics have prompted President Muhammadu Buhari to declare an emergency and announce a national action plan to address the crisis.
I call on all state governments to complement this effort by according the sector similar recognition to enable us to work together to achieve the Sustainable Development Goals targets for water supply, sanitation and hygiene by 2030. Henceforth, federal government support to state governments will be based on their commitment to implement the national water supply, sanitation and action plan in their respective states and to end open defecation by 2025.
The 36 state administrations are crucial to the success of the initiative. It's primarily their responsibility to provide potable water.
When we saw the statistics and we saw the problem that we had, bearing in mind that the access to water supply sanitation is declining everywhere, it was taken to the National Council on Water Resources, where a decision was made that we need to work together, the state and the federal government, local government, to develop a national action plan that will renew the partnership between federal, state, local government to collaborate, to work more, and also to put in development partners' efforts together towards increasing and improving access to water supply, sanitation, and hygiene.
Children are most vulnerable, with tens of thousands of under the age of 5 dying of diarrhea. The UN estimates the government will need to invest around $8 billion a year if it wants to resolve its water supply challenges. Deju Madmus, CGTN, Lagos, Nigeria.